Dr. Ankita Sharma, please come to the podium. Dr. Ankita will be speaking on association of serum 25 hydroxy cholecalciferol levels in cataractus and non-cataractus patient.
Shall we start? Yes. Good morning, everyone. Today we shall go through a study which is of the association of serum 25 hydroxy cholecalciferol levels in cataractus and non-cataractus patients who were reporting to a tertiary care hospital in eastern India. I have no financial interest to disclose. So it's a well-known fact that age-related cataract is due to the loss of lens transparency. It can also be because of other factors like micronutrient deficiencies, for example, of essential vitamins and minerals. Vitamin D has been crowned as the sunshine vitamin. It serves a number of extraskeletal and skeletal functions. And the measurement of the level of serum 25 hydroxy vitamin D helps us to know whether the patient is insufficient or deficient. So a value of less than 30 nanograms per ml is taken as vitamin D insufficiency. This is a chart which helps us go through the synthesis of vitamin D in the body. So the problem statement here is that cataract, according to WHO, is the leading cause of blindness all over the world, accounting for 47.8% cases of blindness worldwide. According to the National Blindness and Visual Impairment Survey India, untreated cataract was responsible for 66.2% of blindness and visual impairment in population aged greater than 50 years. The rationale behind doing this study is the antioxidant property of vitamin D, which could help us in prevention of senile cataract by preventing the oxidative stress. The novelty behind this study is that no such study had been done previously in eastern India. So our aim was to evaluate the association between serum levels of vitamin D and the occurrence of type of cataract. And the research objective was to see the levels of vitamin D among cataractus and non-cataractus age-matched controls. So these were studies which had similar parameters and had found statistically significant difference in the vitamin D levels between the two groups. A study by Abdullah et al., which was done in 2019, it had found a difference between the two groups, and also that minimum level of vitamin D is there in nuclear cataract. Also, it found severe deficiency, that is less than 10 nanograms per ml in vitamin in the cataractus patients. So it was a cross-sectional hospital-based analytical study done over a period of 1 year in the Department of Ophthalmology of AIIMS Patna. This was the formula used for sample size calculation. Our inclusion criteria for group 1 was all patients with cataractus lens in the age group of 40 to 60 years. And we excluded those who had systemic illnesses like diabetes, hypertension, hyperparathyroidism or hypoparathyroidism states. Similarly, in group 2, we took controls who had non-cataractus lenses in the same age group and again without any systemic illness. This was the study procedure, followed the entire examination and then measurement of the levels in the biochemistry lab. So these were our outcome variables. Vitamin D levels were measured by chemiluminescence-based immunoassay. Same method was used for serum parathormone. For calcium levels, we had used photometry using Beckman Coulter. The statistical analysis method used was, we used the Jamovi software. An independent t-test was applied for normally distributed and Mann-Whitney u-test for not normally distributed. So in our results, we saw that the morphologies of cataract in the worst size of group 1 had mixed morphology, being of the highest variety. And this mixed morphology also had the highest amount of serum vitamin D levels, whereas it was lowest among nuclear sclerotic cataracts. The mean difference of vitamin D levels between the cataractus and the non-cataractus groups, it was found to be statistically insignificant. Similar results we had seen in parathormone levels as well as for calcium levels. These were the two studies with which our parameters had matched, so we had taken them into consideration. The strength of our study is that still no well-defined threshold is there for vitamin D levels in the serum of cataractus and non-cataractus patients. So if we are able to estimate such a kind of a threshold, then maybe it might help us in prevention. And finding of least serum mean vitamin D levels in nuclear sclerotic cataracts also can help us in associating the vitamin D levels with the type of cataract. The limitations were that ours was a small sample size given the limited duration for recruitment, and also high performance liquid chromatography mass spectrophotometry is the gold standard which should be used for the estimation of serum vitamin D levels, but it was unavailable in our institute. That's why we resorted to CLIA. So small studies can, like ours, it can provide significant evidence regarding association between development of age-related cataract and serum vitamin D levels. It's also important to keep in mind the interrelationship that exists between age, serum vitamin D, serum calcium, and serum parathormone levels while we interpret and apply the results of such studies. Thank you so much.